Come in.
Hi, my name is Chris, and I'll be your student nurse. Could you tell me your name and your date of birth?
Yeah, Tanner Gapbear, 11/16/91.
Okay. And can I double check that with your wristband?
Sure.
All right, that's correct. Okay, what is the reason that you're visiting us today?
Just a physical.
Oh, okay. And can you tell me the date?
It's Thursday, June 7th.
Do you have any pain?
No, I have zero pain.
And how do you grade that from 0 to 10?
A 0.
All right. Are you comfortable right now, or do I need to get you like in a...
No, I feel comfortable.
No? You're
Yeah.
comfortable? Okay. Well, let me know if you're not. I want to keep you safe at all times.
Okay.
All right? Okay. Patient's consciousness, and he's conscious and he's alert. He stated the place, the time, the date, why he's here, and his name. All right. And what have you eaten in the past 24 hours?
This morning I had some fruit and oatmeal, and then for lunch I had a sandwich.
Okay. Patient seems to have a well-rounded diet, and he appears to be proportional from height to his body. And he seems to have a good BMI. His posture is erect, and he looks comfortable. He doesn't have any obvious deformities. And his mood, he appears content and smiling. His speech, he speaks native English, and it appears to be appropriate to the situation. Can you tell me how many times you shower a week?
Probably 7.
7
Once
times?
every day, yeah.
That's good. So you have you would say that you would have good hygiene?
Yeah, I have good hygiene.
All right. Patient appears clean. He appears to have used deodorant, and his skin appears clean as well, not dirty. All right. Next, I'm going to assess your skin. Let me do my hand hygiene. All right. Okay. So skin appears appropriate. And the color appears pink, and it's smooth, and it's appropriate to the ethnicity. I'm gonna check your, and it's also dry and warm. I'm gonna check your turgor. And it's elastic, it comes back to skin, there appears no dehydration. I'm gonna check your nails next.
Okay.
Okay, nails are pink and they look the same throughout. And your capillary reflex is a 1. All right. So it looks like you're really hydrated.
Yeah.
Oh, that's great. Okay. So now I'm going to check your eyes. Okay, Tanner?
Okay.
Are you ready?
Mm-hmm.
Okay. Oh, here it is. Okay. So I'm going to do a confrontation test. Can you cover your right eye, please? Okay. Whenever you see my finger come into the picture, or you look at me, and whenever you see my finger, let me know. Okay?
Yep. 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 Yep.
All right. And then the other hand.
Yep. Yes. Yes. Yes.
Cranial 2 appears to be intact. And now can you pull down your eyes for me, please? Okay. So patient's conjunctiva is pink. His sclera is clear. His corneas are rounded. His irises are brown, and his pupils appear symmetrical to his eye. Okay, now we're gonna do this test where you're gonna look into my light, okay?
Okay.
Okay, patient's pupils constrict upon light. And let's do this again. Okay, and the light reflects on the other eye symmetrically. Can you follow my pen, please?
Sure.
I'm trying to go slow. I don't want to make you dizzy. All right. Good job, Tanner. Your cranial nerves 3, 4, and 6 appear intact. Could you look behind me, please? And follow my pen when I get near, okay?
Okay.
Okay, can you look behind me again? Okay, good job. Patient appears to respond to accommodation from the fixation behind the wall. He accommodated his eyes to my finger. So, okay, I'm going to do your ears next. Are
Okay.
you ready for that?
Yep.
Are you comfortable?
Yep. Let's go.
Okay. I'm going to test your ears. I'm going to whisper 3 words in each side, and you got to repeat it, okay?
Okay. 1, 2, 3.
Mm-hmm.
4, 5, 6.
Okay, so the patient's whispering test confirmed that his cranial 8 is intact. All right, and now I'm going to check your tympanic membrane.
Okay.
Okay, can you look that way, please? Oh, nice. Okay, your tympanic membrane seems pearly and gray and rounded, and there was barely any serum in there. And I'm gonna check your ears. Okay, your ear structures appear smooth and warm. Okay, can you please imitate what I'm gonna do?
Sure.
Can you blow your face like this? And then raise your eyebrows. And then make an angry face. Okay, good job. Your facial symmetry is appropriate, and your cranial nerve 7 it has been intact. Now I'm gonna assess your scalp, your hair, and your cranium. Okay?
Okay.
Okay. Patient's hair is black and shiny. There's no masses or abnormal deformities that are noted on the scalp. And his cranium doesn't have any soft spars. Okay. All right, can you bite down for me?
Yeah.
Let me. Okay. Okay, his temporal mandibular joint is good, and you can sense it. It's intact. I'm gonna touch your face now,
Okay.
and you're gonna tell me if it hurts, okay?
Okay. Nope. I can just feel you touching.
Okay, good. So your maxillary and frontal sinuses are good. I'm going to test your sensation. You're gonna tell me this is sharp and this is smooth.
Okay.
Okay, can you close your eyes, please?
Sharp. Smooth. Sharp. Sharp. Smooth.
Okay. So patient's sensation seems, he seems to have the feeling that what is smooth and what is sharp, so his cranial nerve 5 is intact. I need you to please close one of your nostrils.
Okay.
And then go. See, Tanner, what I just tested was your patency, and it appears to be appropriate.
Okay.
Okay, now I'm going to inspect your lips and mouth. Are you doing well still?
Yeah. Feel good.
Okay. Okay. Please say ah for me. Ooh. I'm going to put it a little bit farther. Oh, I'm sorry. Okay. All right. Can you go like this? Okay, so your uvula seems to be a size of 2. Your gag reflex, you have a gag reflex. So, and also your teeth appear clean, and white, and they appear to be throughout the same size. Your gums, let me see your gums again. They're pink and moist, and your buccal is pink and moist. And okay, and your soft palate seem to be pink and moist too. All right, so your cranial nerves 9 and 10 seem to be intact after. Can you swallow for me?
Yep.
Okay. Yes, they do. And can you stick out your tongue? Can you move it side to side? Okay, so patient's tongue, he moved it lateral, and it appears to be that the cranial nerve 12 seems to be intact as well. Thank you, Tanner. Hold on. Last thing we're gonna test is your neck.
Okay.
All right. I'm gonna palpate for lymph nodes. Okay. Okay. There's no lymph nodes in his submandibular. Sorry, submandibular, the occipital, the pre-auricular. Sorry. Everything seems to be appropriate. You don't have any palpated lymph nodes. And now I'm gonna test your carotid pulse. Okay. There's no jugular veins popping out, and everything appears to be appropriate. I'm gonna put my hand on your face, and please, could you push against it? Okay, there seems to be resistance when I push against the patient's face, and that tells me that the cranial nerve 11 is intact. Now, could you turn your head both sides, up and down? Okay, and your patient's movements, he appears to have mobility within his neck and his face. Thank you, Tanner. You did great.
All right.
I appreciate that time you took today to come by.
Thank you.
Good job.